Good morning and welcome, everyone. In the interest of time, we're going to get started. I'm sure that more people will be joining us as we go. We're still waiting for one of our speakers who is on his way. He'll be coming in. But I'd just like to welcome you all to our session this morning. For those of you who are here with us in person, thank you so much for braving the early morning and coming out. We really appreciate your presence. For those of you who are online, welcome. Wherever you are in the world joining us, we're really glad that you're here with us. My name is Anil Padavatan. I'm the health lead with GATE, Global Action for Trans Equality, and I'm based in South Africa. And I'm joined today by a fantastic panel. I'm going to actually hand over to each of them now to just briefly introduce themselves and tell you who they are and where in the world they're from. So, starting with you, Daniel, if you want to just introduce yourself.
Hi, my name is Daniel. I come from Colombia. I work with GAD Foundation. I am a trans man living with HIV, and I think that's going to be relevant for the rest of the sessions. I just wanted to state it now. Yeah.
Morning, everyone. I'm Abi from Indonesia. I work as advisory board of Arus Pelangi, a national LGBTQ plus federation in Indonesia. Thank you.
Hi, good morning. My name's Keenan. I work for ILGA Europe, the European region of the International Lesbian, Gay, Bisexual, Trans, and Intersex Association. And I also do a good deal of work on trans folks and sexual violence.
And we are now being joined by Jay Malucha. Hi, Jay, and welcome. So glad that... Yep. Thank you again for the way you represented our community.
You're
if you just
welcome.
want to, for those who might possibly not know who you are, if you want to introduce yourself.
Good morning, everyone. Apologies, I ran in late. My name is Jamulucha. I'm a trans man from Uganda, and I'm the Executive Director of Femme Alliance Uganda. Thank you so much.
So, we are all members of the International Working Group on Transmasculine People and HIV. For those of you who haven't yet encountered our work, just a brief introduction. The working group is coordinated by GATE, and we consist of 30 transmasculine activists, researchers, public health experts from 22 different countries across all global regions. We are all members, we are all trans men or members of the gender diverse community, and we are all experts working in the field of HIV and public health. We are also a community-led group and a good practice example of community-driven advocacy to improve access to healthcare. And our aim is to improve the inclusion of trans men in the global HIV response as a vital step towards ending HIV as a health threat. Just to give a bit of the context of the invisibilization that we're facing, which my colleagues are going to be enlarging on during the session. The HIV response, as we know, is still not reaching many vulnerable and marginalized communities. And despite a lot of emerging evidence on the vulnerability of trans men and other gender diverse persons assigned female at birth, we are still largely excluded from HIV programming and also from data collection and research. And this becomes a vicious cycle. So for example, just to take one country example, a 2023 study from Zimbabwe that was looking at various communities involved in sex work found prevalence levels of 38.4% amongst trans men sex workers in Zimbabwe. So that is HIV prevalence levels of 38.4% for trans men sex workers. But in Zimbabwe, trans men are still largely excluded from HIV service provision and from HIV data collection. And I've got a quote here from Sam Ndlovu, who is our working group member who's based in Zimbabwe, and who says that, just to bring this home, in the patriarchal context of Zimbabwe, which creates complex risk for transgender men and other gender diverse persons assigned female at birth, we are still having very, very low levels of awareness about the trans community in general, trans men in particular amongst healthcare providers. The services are not there. When people arrive at healthcare facilities, healthcare providers don't know how to provide them with services. There is no relevant information, even on the basics of using condoms and barrier methods to prevent HIV. And at the moment, Zimbabwe is currently engaged in their second biobehavioral study. And once again, despite that emerging data on the risk of transgender men, that study will include other key populations and transgender women, thank goodness, but not transgender men. So what are we doing with regards to this? We conduct advocacy, we produce critical knowledge on trans men and HIV, we develop strategies to improve the meaningful engagement of our communities in health responses, and we try to ensure that community members have the knowledge and tools to first of all be able to take control of their own health and make informed decisions about their own bodies, but also to engage in activism and advocate for their rights. And in 2023, we developed a document which Keenan is going to tell us a bit more about later in the session, our policy brief on the effective inclusion of trans men in the global HIV response. We have copies of the policy brief here. Those of you who are with us in the room, we will be handing out copies after the session and you will each receive one. For those of you who are joining us virtually, you can go to the GATE website, www.gate.ngo, and there you will be able to navigate via our Knowledge Hub to our health section, to trans men and HIV, and you will be able to download your copy of the policy brief. But just to say up front, and I know that our speakers will also be echoing this, but to make it crystal clear, when we are talking about the inclusion of trans men and other gender diverse persons in the HIV response, we are not in any way suggesting that resources should be taken away from the programming for trans women and divided now amongst an enlarged community. We know with transgender women we have some of the highest prevalence levels, some of the lowest levels of viral suppression, and some of the least funding of all vulnerable communities already included in the HIV response. Programming for trans women is disgracefully underfunded, and what we need is additional funding to adequately fund programming for trans women, and we need to include the entire trans and gender diverse community in the HIV response. I am going to now hand over to our panelists just to give a bit more of a context on what is happening in the world and in the various global regions. And I'm going to hand over to you, Jay, if you could please tell us a bit more about what is happening with trans men and HIV in Uganda.
Thank you so much, Anil. As I always say, my talk will be mainly based on Uganda, but I know this is what is happening in most criminalized countries. It is estimated that 68 countries still have laws that criminalize populations who engage in same-sex relations. Of these countries, 21 are believed to criminalize transgender people. We have lately registered high numbers of new HIV infections and issues of drug adherence among our communities. This is also triggered by excessive use of drugs due to mental health issues and other internal factors, but not forgetting the implications of the Anti-Homosexuality Act 2023 on the health service providers. This is very alarming, as this will continue if responsive mechanisms are not put in place. The HIV prevalence among our community will continue to rise as it was during the COVID-19 pandemic, thus weakening our previous efforts to curb the disease. Permit me to shed light on a critical issue affecting the marginalized trans and gender diverse persons in Uganda and other countries in criminalized context who face heightened risks of HIV due to stigma, discrimination, and limited access to health care services. This is a very pressing issue which demands our attention and empathy. The intersection of trans men and the heightened risk of HIV transmission in criminalized contexts. This topic is often overlooked, yet it affects the lives of many marginalized and vulnerable individuals in our society. On a daily basis, trans men face unique challenges and discrimination which are further exacerbated by living in criminalized contexts like Uganda. When we are forced to live on the margins of society due to discriminatory laws and policies, we are more likely to engage in risky behaviors in order to survive. This includes engaging in sex work, substance abuse, and other behaviors in order to survive. Activities that put us at a higher risk of contacting HIV. Moreover, we trans men often face barriers to accessing health care services, including HIV testing, treatment, and prevention. Stigma, discrimination, and lack of understanding from healthcare service providers prevents us from seeking the care we need, further increasing our vulnerability to HIV. I will give an example of some health workers in my country. When trans men go to the health facilities, instead of health service providers giving us the services we need, we are always asked transphobic questions like, are you a man or woman? If you are a man, why don't you have male private parts? Can you make a woman pregnant? You say you have sex with women, so how did you get HIV? Such questions have made us stay away from accessing health services, and we have ended up not adhering to medication or and we end up doing self-medication, which is too dangerous to our lives. After the signing into law of the AHA in 2023, that is the Anti-Homosexuality Act, we face a lot of challenges. We have faced one of the hardest times in our lives. Attacks, violation, eviction, and arrests happen on a daily. And these mainly affect the trans persons. Being the face of homosexuality in Uganda, transgender people are seen as the key promoters and recruiters of children, among others, into homosexuality, leading to homelessness and lack of safe space to operate and can easily be identified. Of course, these violations have always happened, but this wasn't after the law was passed. These harsh laws and policies have prevented us from seeking HIV testing, treatment, and care by creating a hostile healthcare setting with breaches in confidentiality and verbal abuse. The healthcare service providers do not practice confidentiality, hence making it hard for us to go and access services. As trans men, we have been left out in a lot of HIV programming and funding. Recent global statistics of trans HIV funding are heartbreaking. HIV funding is not reaching the most vulnerable communities. Huge budgets are out there, but too little of this reach the trans. Why are we left out of many programmings? I will still ask that question. There is a myth that trans men don't acquire HIV. Do we have green blood? Or are we not human? It's not surprising that AIDS 2024 is about putting people first. Why not put all people first? Shouldn't access to healthcare service include HIV prevention and treatment? Shouldn't it be a basic human right for all individuals regardless of their gender identity? The passing of the Anti-Homosexuality Act affected the attendance at our drop-in center for SRHR services. And most members resorted to self-medication, a very dangerous practice. This was worsened by lack of food, as some members are worried of the adverse effects of taking medication without proper meals. The situation isn't helped by the fact that donors are now skeptical in releasing funds to transgender, among other LGBTI organizations, because the law has made it risky. There has also been a high burden on trans men on ART, fear in accessing gender-affirming treatment due to frequent reporting to the police and subsequent arrests, and heightened levels of mental health challenges ranging from depression and anxiety to panic attacks and suicidal tendencies. It's no surprise, therefore, that most members are now struggling with the accessing life-saving medication like PrEP and PEP. It's crucial that we recognize and address the systematic factors that contribute to the increased risk of HIV among transgender individuals in nations like Uganda. We must work towards creating a more inclusive and supportive environment that respects the rights, dignity of all individuals, regardless of their gender identity. We must advocate for policies and programs that prioritize the health and well-being of transgender individuals, including accessing to comprehensive health care services, education, and support networks. We must challenge stigma and discrimination at all levels and work towards creating a more just and equitable society for all. I urge each and every one of us to stand in solidarity with the trans men in Uganda and around the world over, and work towards creating a world where everyone can live with dignity, respect, and without fear of discrimination or violence. Let's strive to create a future where all individuals, regardless of their gender identity, can live healthy, fulfilling lives free from the threat of HIV and other preventable diseases. Thank you so much.
Thank you so much, Jay, for very vividly showing us why this work is so important. As I said, what we of the working group have done is we have developed what is the first comprehensive resource on improving the inclusion of trans men in the global HIV response. And I'm going to hand over to Keenan now to just give a bit more background, first of all, on the history of the working group, and also on the process of developing the policy brief. Over to you.
Thanks, Anil. When I was asked to talk about the history of the policy brief, something I realized quickly thinking about what I wanted to say is that it's really necessary to zoom out for a second. HIV has had a foothold in trans men and transmasculine communities for as long as HIV has been around. And for those of us my age or older who are in the English-speaking context, one really important name is that of Lou Sullivan, who was an active trans man in gay male spaces in the 80s and 90s and contracted HIV and died of HIV-related AIDS-related complications in 1991. He was a key movement builder and was the host of by mail at this time in the 90s, right? Mailing a newsletter to trans men around the world, a key connection point that we lost in a response that still, almost 35 years later, doesn't see us. At the time and up until really the 2010s, trans men's sexuality has been assumed to be heterosexual, and there's actually been a good deal of hostility among trans men and transmasculine communities towards gay and bisexual trans men. and a significant amount of invisibility of trans men who engage in sex work, trans men who use drugs, and the amount of sexual violence that we're subjected to. Though there have been, over the years, community-based participatory research projects looking into our sexual practices, but it's kind of stopped there. GATE was founded in 2009 by two trans men who have sex with men, Mauro Cabral-Greenspan and Justus Eisfeld. And GATE itself was a key actor in the formation of IRGT, the International Reference Group on Trans People and HIV, of which Mauro was an original co-chair. That was a project funded first through MSMGF in 2011 and then was formalized at an AIDS conference in 2012. The focus, though, of IRGT quickly switched to being focused largely and then exclusively on trans women and HIV. And trans men remained largely invisible in the global conversation on HIV, with single digits of publications focused on our issues up until the mid-2010s, only 10 years ago. There was active exclusion from research targeting MSM, as well as active exclusion from research targeting trans women, exclusion from clinical trials, and a widespread presumption about the generalizability of the effectiveness of medications and services targeting cis women, as though they applied to us, to our bodies and our sexual practices. At the AIDS conference in 2016 in Durban, there were a handful of transmasculine attendees at that conference, and following that conference, seeing how limited the attention continued to be on our issues, a group of 35 transmasculine folks developed and published the Durban Declaration, which is also available on GATE's website, gate.ngo, and I understand that it is pinned for today, so you can go and find it. The Durban Declaration noted the extreme gap in data about trans men and HIV, and called for increased attention to this issue. Because as a key principle of this conversation, and what continues to be the case, is that the absence of evidence is not an evidence of, or it's not evidence of an absence. It's just evidence that there is limited attention being paid to this question. As a concrete example to this, the European MSM Internet Survey conducted in 2010, 2017, and again this year in 2024, the 2010 version of that survey did disaggregate trans people from cisgender men, but had single digits of responses out of 7,200 respondents who identified themselves as trans men. We did see a significant increase in transmasculine participants from 2010 to 2017, with over 1,000 respondents in 2017 who identified themselves as trans men out of 125,000 respondents. But there continues to be, as Anil was mentioning, exclusion from IBBS surveys in different countries around the world, and that means that the data is still lagging significantly behind. Thus, on World AIDS Day in 2018, GATE launched a call for members of this working group, the Trans Men and HIV Working Group. Initially, there were about 15 people in the group from around the world, and shortly thereafter, GATE was able to find the funding to hire a part-time coordinator for the group to ensure that it was able to meet and be structured and have the resources necessary. But to this day, the group has never had a fully funded in-person meeting. All of those meetings have been cross-continent, cross-time zone, and for many of us, this is the first time we meet. So there's such a gap there in terms of just the capacity to organize ourselves to make the demands that are necessary to make. Working since then, the Trans Men and HIV Working Group has, via our individual engagement and our participation in HIV-related conferences around the world based on where we are and the kind of access we're able to get, has worked to raise visibility to this issue. And in 2022, GATE was able to secure funding to work on the policy paper. That policy paper was a project of this working group. We had a even smaller sub-working group, I guess, working on the development with a consultant that we were able to hire, with the target of creating a comprehensive document that pulled together the limited pieces of information and pointed to the gaps that desperately need to be filled in terms of data collection, as well as to really concrete policy demands. We were able then to publish that policy paper in 2023. That, starting in 2016, was a 7-year process, but really this entire discussion started much, much earlier and has culminated only now in the first ever comprehensive document on our communities and what we need in the context of the HIV response. With that, I hand us back so we can talk about the contents. Forgot something. There's one person who should be here, who was a key actor in the history, and that's Manuel Quinta. We lost him a couple of years ago, but he was a very, very key early listener from the AIDS response to the need to pay attention to transmitted HIV, and we lost him to HIV-related complications in 2021. So just a moment to say rest in peace to Manuel.
Thank you so much for that, for giving us the history, and also for recognizing how many people have contributed to this process over the years. It's given us a lot of context now to move on to the content of the policy brief. It's a very comprehensive document, so we've done a summary of some of the recommendations from the document today, and I'm going to hand over to Abi. I'm not sure if you want to come up here or if you're just going to stay.
I'm just going to stay here.
I will be your driver. Okay.
Yeah, all right. Good morning. About the comprehensive document of transparent and HIV policy brief, we highlight some recommendations that is divided into 4 parts. So, yeah, it's because of the lack of data and lack of inclusion on transmasculine in HIV response. So we create this policy brief and to make sure that our voices can be heard to the global HIV responses. Yeah, and the first recommendation is for WHO, UNAIDS, UNFPA, and the global technical teams. Yeah, because of the emerging HIV prevalence and risk data, we need to specifically identify trans men and gender diverse people assigned female at birth as a key population. As we know nowadays, the term key population only mentioning transgender, which is associated to transgender women. So, where are we? Yeah, and the second recommendation is to provide technical support to facilitate the inclusion of trans men and gender diverse person in data collection, national strategic plans, and design, delivery of HIV and sexual reproductive health and STI intervention. I need to highlight this point because we are not only data, we are humans, and we need to be involved directly as an expert of our issues to the national strategic plannings. And of course, we need to address the violence against trans person and support the community-led monitoring and responses to violence, ensure gender-based violence services are trans-competent, inclusive, and sensitive. And we urgently need a guidance that gender-affirming care should be integrated to HIV and sexual reproductive health services. Next. Yeah, and the next group of recommendation is for the Global Fund, PEPFAR, and other sexual SRH and HIV donors. Yeah, we need to allocate the specific funding to HIV response to trans communities, inclusive of trans women, trans men, and gender diverse person. And we also need to be included in behavioral research so that national strategic plans and resource allocation are informed by accurate epidemiological data. And yeah, of course, we need to recognize the resource and inclusion of trans men and trans women and gender diverse person as professionals in research. Just like what I said, we are not just data, we are not just numbers. Because who can talk better about trans people if it's not trans people ourselves? And we also need to support and resource community-led organization in countering the anti-rights and anti-gender search and other drivers of violence and discrimination and stigma. And please provide technical and financial support to ensure that sexual reproductive health services for trans men and gender diverse person is included in health services and the minimum initial service package during crisis situations. Yeah, and the next part is for the national policymakers and ministries of health. We need to recognize that human rights as a critical component of effective health response, and explicitly include trans men and gender diverse person assigned female at birth in definition of trans person as key population. Yeah, and we also need to be engaged in meaningful engagement of trans men and gender diverse person assigned female at birth in decision-making process, and address structural barriers and increase access to testing, PrEP and PEP, and other prevention services. Yeah, and yeah, this is the continuation for the policymakers. Collect the disaggregate HIV surveillance data, expand the partnership and resources to translate organizations to deliver the HIV prevention testing and linkages to treatment and services. And we need to implement healthcare worker education and training to establish competence in providing HIV prevention, testing, treatment, and care to trans men and gender diverse person assigned female at birth. And the last point for the policymakers will be to include gender-affirming care in HIV and sexual reproductive health services, given the strong evidence of gender-affirming care as an important pathway into HIV care. This should be a priority intervention. And the last recommendation will be for the international civil society organizations. We need to support training that includes specific health needs of trans men and gender diverse person assigned female at birth to ensure the inclusive trans competent service provision. Support prevention awareness campaign targeting men who have sex with men that explicitly include trans men and gender diverse person assigned female at birth who have sex with men. And strengthen the capacity to community-led monitoring of trans persons' risk, human rights abuse, and barriers to accessing SRH and HIV services. And the last recommendation is to support trans-led advocacy for decriminalization and other structural changes to reduce trans person vulnerability to HIV. Thank you.
So thank you so much, Abi, for doing a brilliant job for a very difficult task, which was to summarize the very comprehensive recommendations into 4 slides. Thank you so much for that. I'm going to now hand over to Daniel. If you can just briefly tell us about the work that you're doing in Colombia.
Yeah, thank you for that, and thank you for my fellow panelists to set up the mood of the session. So first, I'm gonna give a little bit of context of what GATT Foundation is in Colombia. We are a community-based, community-based organization for trans people. We've been working for 15 years for human rights and the rights of transgender people in Colombia. And we were pioneers for setting the self-identifying laws that guided the country to creating the possibility of changing name and gender markers in our documents. So we've had several avenues of different works for the trans community, and most recently we've been more involved with HIV, giving the vulnerability of our population, but also the arising situations that we've encountered with trans men living with HIV. So that's a little bit of context of what I do. How the HIV with the inclusion of trans men began was in a form of alliance with other organizations and fast-track cities in Colombia, so that we could actually map out what our intentions were going to be in establishing ourselves or including ourselves into these groups. We then created a strategy of visibility for trans men living with HIV. That was myself standing in Congress speaking about the necessity of including the data that we already have regarding the importance of including men that live with HIV who are either non-binary or trans-masculine individuals. After setting that visibility, what we wanted to achieve the most is specifically the importance of including community-led responses to this cause. So it is, it's very interesting to me how in all of these spaces, the most that you hear is put people first, and the UNAIDS, the UNAIDS motto this past couple of years have been include the communities better, reach out to the communities better. And what we've seen is that the communities are always left on the sidelines, and that our work is always a little bit on the shadows and severely underfunded. So it difficults a lot of how much power or how much access can we actually have in order to create an accurate response to this situation that we have with trans men who have been systematically invisibilized in this fight against HIV. So what we have, and the importance of the community-led organization responses, is how else are we supposed to do it? Because people come to first the community, and then maybe they think about reaching health providers. Maybe then they think about reaching state. And all of this, it's because of the systematic exclusion that they faced. It's all because of the challenges that they faced within the government or within their own situations and their own internalized transphobia or just the blunt stigma of HIV. So we decided that it was the moment to take action, and we created online support groups only for trans men living with HIV. This this was a project that was basically made by will. There was no funding whatsoever. We dedicated time to identify the community. We took the time to understand what the necessities of this community was, because we all live in our very particulars, in our own particularities. Colombia is a very geographically diverse country, and that poses a huge challenge when it comes to homogenizing public policy as a whole. So what we try to do is understand what the challenges were for people that lived not just in Bogota, but outside the urban areas, so that we could better understand what the barriers of access were. And we found so much incredible data that it really makes me wonder, why is this not out there? If the data is there, you just need to reach out to the right community, and you just need to reach out to the community-based organizations that are already there working in the field with people that already have these issues and are facing stigma, discrimination, and so on. So these online support groups were completely confidential. We decided that people that joined the support group didn't have to put their camera on if they didn't feel like it. It's obviously something that still might be challenging for people to face their status, to face other peers. But definitely we started not only understanding our population, understanding data, collecting data, but also we dissected kind of what the necessities were for trans men in Colombia in particular, and how the state or how the public health in their sectors were reacting to trans individuals, trans masculine individuals. One of the things that I want to highlight about these groups was the reduction of stigma. Once we understand our community, we can see each other and we can kind of support each other, stigma starts alleviating, and you build community and you build support, and you see yourself reflecting in someone else's reality, and then you feel like, I am not alone in this fight. You know, I might be kilometers away, but then I am living the same reality and the same challenges that someone else is. So progressively, we had over 8 groups, and at the end, we started seeing more faces in the Zoom. We started seeing more open conversations about other types of situations, not only regarding HIV, but livelihoods. What do you do for a living? You know, how are you face your day-to-day? We were putting people to a status, and we were putting their reality and who they were first. So gradually the stigma was slowly reducing itself within the group. I can only just imagine how important this would be on a worldwide scale if we could openly talk about this situation, and we could openly gather like trans masculine, non-binary individuals and say like, yeah, you know, just as I casually say it when I jumped into stage, I live with HIV, and this shouldn't be something that is anything other than a status. It's just what it is. And I am a person, I have a life, I have a job, I have my education, I have all of these other things, and this is what we want to focus on, the livelihoods of people. So yeah, unfortunately, obviously, as Anil was saying in the beginning, these projects are severely underfunded, and whenever we go and reach out to institutions about HIV, the first response that we get is, where are the trans women? And our fellow trans women need representation, that is for sure, and that is something that I want to also state here. But expanding rights and expanding healthcare and expanding this movement does not necessarily mean the reduction of others' fights. It just means the expansion of them all. I mean, people complain in public health spaces that there is no data. I challenge that, because there is data, you just don't know where to find it. And if you're never gonna find it, if you don't go to the right people, and especially if you do not reach out to the community-led responses or organizations that are already on the ground and that have by firsthand the outreach to the community that you're looking for. So that's just my take. I just encourage you to look for the community, because in bigger spaces or in rooms with more important people, answers are not going to be there. They're going to be in the ground.
Thank you so much, Daniel. We now have about 5 minutes to take a few questions, if anyone has got any questions. For those of you who are online, feel free to put your questions in the Q&A. And if anyone would like to stand up and take the mic and ask a question, please go ahead.
Good morning, everyone. Thank you so much for this talk. My name is Sandro Niederer. I work with the Swiss AIDS Federation, and I'm a trans man living with HIV. This was one of the most amazing things I've seen in my life, so thank you so much for being here. I have a question. We tried to work with the transmasculine community. One big issue that we face, both with our facilitators, but also with the people, is that dysphoria and the general discomfort that people face around their genitals, around their sexuality, leads them to not wanting to talk about safer sex, safer use, safer hormone use, but also that a lot of trans men who are gay somehow try to validate their homosexuality by having unsafe sex as a way to show their masculinity. And I was wondering if any of you encountered that as well, and if so, how you approached it. Thank you.
So, Keenan, I don't know if you want to go ahead. Yeah.
I think there's several pieces in there. Maybe I want to start with the one that I think is maybe the most difficult to unpack, which is about the kinds of sexual practices that particularly gay and bisexual trans men engage in. Absolutely, there is a component of sort of risk-taking that is about validation of one's identity. There's also a very serious component that is about sexual social pressure that transmasculine folks receive from cisgender gay men. And the types of demands put on our bodies and our capacity to consent that pressure us to engage in more risky behaviors, but to be able to seek the kinds of validation that we need from fellow gay and bisexual men. And I think it's a complicated question when we're unable to really have a thorough discussion about the position and reality of trans men existing inside gay and bisexual male communities. There's sort of a hyper-invisibilization, but there's also active aggression from cis gay men towards trans gay and bisexual men that increases the difficulty and puts trans gay and bisexual men in a position of needing to make riskier decisions just to be able to be validated in their own communities. And so I think it's important to see that risk, like non-risk averse or pro-risk approach as quite complex. Another piece that is difficult that you raise is absolutely the disconnect that many trans-masculine folks can feel with certain parts of their bodies, even while using them. And so a discussion about vaginal intercourse, just using the word, can turn people off from continuing the conversation. Or a conversation about penetrative intercourse with a penis makes people who don't have something that fits their own conception of their bodies also turn off from the conversation. And that really links exactly to the necessity that Daniel was raising about making sure that when these conversations are happening, there are transmasculine folks leading the discussion and able to work to navigate around these sensitive pieces, but it's work, and we need the resources to be able to do the work, to pay for spaces, to pay for food, to pay for people to have the psychosocial support that they need, and to pay for facilitators to hold a safer space, because there's a clear and quite present danger that if we're unable to create the space where we can talk about this, an epidemic that is losing funding and losing attention is going to flare in our communities, and we will sort of disappear on the sidelines.
I want to add something real quick. I think I do highlight the importance of peer work. Seeing, I know that maybe most of you wouldn't like to take the spotlight in the situation, but definitely peer work is extremely important. Being visible in this situation is important, because otherwise there's no way to reach out people who may be leaving the same situations but are not comfortable or not brave or do not find the necessity of coming forward. So having a same lived experience or a peer work is really, it's crucial. Also, establishing guidelines to address diverse genitalia could be something that might work, in the sense that we do not need to call it XYZ, we just need to understand the prevention methods that are out there and how to adequately use them for our community. So a little bit of the difference here is obviously the Colombian context is very different from European led organizations, but we've managed to introduce the topic of PrEP just as a general overview of how to approach the trans men's partners in general to the idea of PrEP. If maybe condoms are unavailable, or maybe condoms are not something that they're interested in, and so on and so forth, that it's not the ideal to an extent, but it's definitely a progress. But I would make sure that within the space that you are creating, just find a way to address genitalia with different names. Maybe the name itself carries the stigma or the weight, but it doesn't have to be that like that. It just needs to be a little bit based on facts and based on the science that's available for all of us.
Thank you so much. I'm seeing the clock ticking and I'm seeing people standing up. If I can ask you to ask a question, we will be able to take one more question really, really quickly and attempt to answer it. But if we're not able to cover it, well, okay, let's take two. We will squeeze them in, but if we're not able to cover other questions, we are going to be, the Trans Men and HIV Working Group are going to be at the Trans Networking Zone in the Global Village tomorrow at 10:30, and we will be able to take your questions then.
All right, then I'll try to be really quick. My name is Zain, I'm from Morocco. My questions are there models of countries or practices that are doing this well that we can point to in our advocacy? So either at the country level or even clinics that are providing HIV services that are inclusive of trans men and like doing it in a way that can be pointed to as a reference. And my second question was about, you mentioned the guidance about including gender-affirming healthcare services as part of sexual and reproductive health services. I also want to know if there is, again, models or data that shows the importance of that, that shows how that impacts trans people accessing the sexual and reproductive health services, because both those things can be really helpful for our advocacy. Thank you.
Thanks so much. If I can try to answer that really briefly, just with an example from South Africa. There is a project run by the Wits Reproductive Health Institute, Wits RHI, running trans HIV, clinics for trans and gender diverse persons focused on HIV, includes gender affirming care. They now include transgender men in a very meaningful way. But we had to fight for them to provide those services, and then we had to fight some more for us to be on the community advisory board, but we're there and I can link you with activists involved in that. Next question.
More a comment than a question. My name is Mauro Carvalho Greenspan. I've been involved in the field of working on trans men and HIV for a quite long time, especially around issues of trans men who have sex with men. And I have seen all of us working together for quite a long time. It always seems to be the first time for everything, and this is the first event like this. I never thought I was going to be able to see something like that in my lifetime. But I also have to say that a lot of the resistance to include these issues don't come from our own community, comes many times for the cis gay community, the MSM community. For many, many years, we have seen that basically people like us don't exist. So, and I believe that that resistance is still there. So while we need to keep organizing, I would urge everyone related with our community, and especially the cis gay community, to do better in understanding not only our bodies and our sexual practices, but also their own bodies and their own desires and their own sexual practices, especially when they include people like us. Thank you.
Thanks so much. Anyone want to take that?
Take the question.
Okay, let's take another question.
Good morning. This is not really a question, but I just want to highlight something. By the way, I'm AR. I'm from the Philippines. I'm also part of the International Working Group for Trans Men. And by the way, I mean, let me ask if we can give a round of applause for this, because I want to highlight that this is the first time that there is a trans man in a session in this conference. My comment is just, I think, I don't want to add to the information that Daniel and Abby and everyone highlighted, that there is an invisibility in the data for trans men. And I just want to highlight for the funders and development partners here that one of the things that adds to that invisibility in my context is that when you write reports, when you write regional reports, and when you use the word transgender, and when you use the word transgender, and then in the footnote you just say that you mean trans women, that adds to the invisibility of trans men. So please, if you or development partners here or here, please, if you mean trans women. Do not use transgender and gender diverse persons if the services or anything you are developing is just for trans women. Thank you.
Thank you so much. And yes, we've got a time for another question. Please go ahead.
Thank you so much. My name is Megan. I'm from Zurich. I work in Checkpoint as counseling. My question is, how do you deal with HPV prevention, gynecologists for trans people, especially trans men? Of course, is there any kind of data or anything? Yep.
So This is a very interesting, tricky question, but we, with the working group, with the support groups that we've managed, we've been able to identify sort of healthcare providers that understand the community. It's not a lot, but to understand maybe basics of gender diversity to kind of assist when it comes to procedures that people have to go through when they go through gynecologists. So we've kind of created not a platform because it's very basic, but we've created a resource mechanism for people who need to get tested or need services to address them. It's complicated because, as I said, it's a context that is very different, and not many people have the access to travel to big cities, and most of these health providers are already established in big cities. But the takeaway from this is find someone who's an ally in the health provider community, and if there is not someone that you can identify, train them. That's always an opportunity. Just, unfortunately, I think that it's on our shoulders to train people at this point, and it sucks, but it's definitely an extra work that we have to do in order to be able to survive.
Thanks so much. I've got a question. Go ahead.
Hey, I think my name is RJ. I am from the Pioneer Filipino Transgender Men Movement in the Philippines. I think one of the things that is also making it a challenge for us to get data is the lack of vulnerability studies for trans men and trans masculine groups. And because of that, we go through the vicious cycle of not having the data to get the support that we need or the funding for research. So I guess this is also a call for our partners and other organizations for us to be able to maybe conduct a vulnerability study, especially in developing countries, and also maybe try to get with the organizations that are local and are trans men led in each of the countries, so that we can provide the data. Thank you.
Thank you so much. So that is an excellent recommendation, I think, for us to end on if we don't have any more questions.
But can I say something about that?
Yeah, go ahead.
Which is that something that only got mentioned very briefly in this session, but I think you're really pointing at, RJ, is part of vulnerability for transmasculine folks is sexual violence. Every study that has ever been conducted on sexual violence in trans communities has found that at least 1 in every 2 transmasculine persons has been subjected to sexual violence. Every single study. And when thinking about vulnerabilities in our community, it's absolutely vital to not focus only on the practices that we choose to engage in, but the practices that take place in our lives, whether we choose them or not.
There was one question that kind of got slipped in the middle about the importance of sexual reproductive health and HRT. So there's more information on the policy brief, just a little bit of advertisement here, so make sure to grab one. But definitely we've highlighted during the policy brief how the lack of access to adequate HRT sets you in a more vulnerable position, and then it kind of reinforces the dangers of not being in a healthy sexual reproductive environment, right? So that's that. It also seriously affects dysphoria for people as well, and not being able to to carry this in a safe way, the HRT. It also puts the communities in very vulnerable positions, especially because people might be sharing injected needles or artifacts that might be harmful, and in the long term be something that could end up with potentially being an HIV case. So that's why it's important, but definitely check out the policy brief.
Thank you so much. We've now come to the end of the time that we've got available for the session. Navon, do you want to give us an ending?
Yeah, so just an announcement that we will be having a gala in the Trans Networking Zone from 4 to 6 today. Please come, have some drinks and some food, chat to us about the policy brief. All of these wonderful speakers will be there. You'll have a chance to talk to them one-on-one. And if that's not enough, we will also have another session with them tomorrow morning in the Trans Networking Zone from 10:45 to 12:30, so please come. Thank you.